I'm Robin Gutman. I'm a licensed mental health counselor, and I specialize in relationships. I work with individuals and with couples too.
Okay, very nice. So I guess I'll ask you questions about relationships and as they relate to mental health. How do you find when there is, for example, bipolar in a relationship? The first question is really, is it possible to create a space where people are in treatment and the relationship is successful and healthy and safe for both parties, the one with the mental illness and the spouse?
So a lot of times I would say that depends on the relationship goals and the therapeutic goals. So it's not necessarily a one-size-fits-all answer, but I would say it depends on those two things, relationship goals and therapy goals. And sometimes all you can do is provide support, and there's less active roles that people can take, and sometimes there's more active roles, really depending on the situation.
What does that mean? Depends on the goals of the relationship. Can you give me an example?
So in different relationships, depending on all of the dynamics and the mental health diagnosis, right, somebody will choose to stay in the relationship and make it work despite the challenges and despite the hurdles. But that relationship will look very different than what a relationship between two, emotionally healthy people would look like.
Okay. And what for the spouse of someone who's suffering from any sort of mental illness, what kind of support do you recommend to give them a better chance at having a success?
So very often a spouse who is with somebody with mental illness will come on their own. And very often they need that space to be validated and to have support and for somebody to understand some of their challenges. Somebody with experience in treating relationships will be able to support them on their journey, because it's a very challenging situation for somebody to be in, for sure.
And I'm kind of taking a totally different turn here, but when you see a couple, I have this a lot, we deal with couples who are going through a marital conflict or divorce, but when they're sort of in the marital conflict stage and they're looking to work towards a reconciliation, I find that they sometimes are looking for a third party, either approval or disapproval on their relationship. What does that look like in a therapeutic setting?
Okay, so that's a great question. I think the therapist always has to stay really neutral. I mean, that's important for a few reasons. Also, when you're dealing with two people, you never want any person to think that the therapist is on his side or her side, right? So that's firstly to try and stay really neutral. And the relationship really doesn't need the therapist's approval, right? It's not about that. It's about, again, I would say clarifying the relationship goals. Like, how committed are you to this relationship, right? What do you want to see happen in 6 months? What are your goals?
So I'm hearing that there's never going to be a third party approval or disapproval.
There shouldn't be.
And if someone's looking for that?
I don't know if anybody can give somebody an answer on what they should do in their relationship. Are they looking for approval in their decision to stay or to leave?
They've been to therapy. They've been to this. They've been to that. They feel like they're kind of at this. They need to give it one last ditch effort so that they feel like they've done absolutely everything that they could possibly do in their control to, contribute to the success of their relationship. But they want to hear from a professional who has seen this and who knows about this and kind of get an opinion on, is there anything to work with here?
Yes. So a therapist, I think, can give an overall assessment of what would need to be done in this relationship. Again, those are the two questions that I said before are very important, right? How committed are you to this relationship?
Yeah.
And what are your goals? And if we can clarify that, let's say in an intake, and then the therapist can give them an assessment of, this is what would need to be done in order to make this work, or if if both parties are not committed to that, then it might not work. So there's that idea of giving some sort of general guidance, not specifically as, to stay or to go, but just of what would need to be done to get to the goals that you're looking for.
Right. I feel like that question of to stay or to go is always going to come back to the client. It's a decision that they have to make on their own.
100%.
There's no barometer of, what is considered successful or not. It looks different for each family.
Yes, right. So what the therapist could do, like I said, is give that assessment and give them ideas of what areas need to be strengthened if they did choose to stay together, or even if they chose not to, how they can manage that. But for sure, if they were choosing to do the work, to be specific in the areas that need strengthening, whether it's certain skills, communication, whatever it is.
Do you ever recommend a separation and see that it is successful in reconciling a relationship?
There could be I don't think I've ever done it personally, but that could be an option to tell somebody to take a little bit of space just to see how that affects them. It could be on the table.
Okay, thank you very much.
Yeah.
I appreciate it.
Sure.